how it's basically a roadblock if we don't know where we're at and how we address it. And as many of us know, the world that we live in is a stressful world. And so on top of that, coming out of a cancer recovery process, there can be a lot of expectations and challenges that make more stress happen. And so finding out where you're at in your stress markers and whether your body's able to produce cortisol on top of maybe not having this roadblock of not having enough vitamin D to support that process is very important. Hi, my name is Dr. Katrina Cox. I'm a naturopathic doctor and the author of The Opportunity in Cancer, where I've decided to do some quick videos about frequently asked questions, and I'm going to focus on different types of cancers. And if you have seen some of our other videos from the YouTube channel, great. These will also be posted there. I have invited my friend, Dr. Quinn Hand, who is also a naturopathic doctor, to ask some of these questions so that we can have it in a more conversational way.
So thanks so much for having me in, Katrina, in order to kind of go through these questions with you today. I think it's a really excellent opportunity for us to be able to touch on a number of the other factors that individuals can be looking at as they go through their recovery process. In particular, we want to talk today about breast cancer. So why don't we dive in and we'll start talking about the alternative monitoring strategies and how to be preventative in the recurrence realm.
Yeah, so conventionally, the monitoring strategies include imaging, scans, sometimes mammograms, and there, of course, are medications for people that are in breast cancer recovery. And the most important thing that I tell patients, or the discussion I have, is cancer itself is more of a metabolic disease. And that's a really important factor. And I'm sure you're asking yourself, what does that even mean, right? Yeah. So a metabolic disease is like, it's impacted on how you function inside of your body. So that can mean that we can alter the inside environment to make it so that it's inhospitable for cancer to grow. And that's really a key component to this prevention and alternative monitoring strategies, because there are markers that we don't use in conventional medicine that have been shown and proven, which I'll talk about in a few minutes, to help reduce or increase the progression-free survival or disease-free survival states. And that's really, really important. So even though cancer is individual, right? So because of that metabolic process, cancer is more individual than we can imagine. But there are similarities, and that's where conventional medicine makes their interventions. The similarities can be, there are hormone receptors, for example, in breast cancer, there's genetic links and those types of things, and those can all be tested for and monitored, and that's really important. However, if you look at it from a metabolic disease process, there are strategies like two tests that I work with patients called CRP, C-reactive protein, and ESR, erythrocyte sedimentation rate. I know, big words. We're going to just say ESR and CRP for the function of this video. Those two have been studied long-term. They're easy. They're inexpensive blood tests. They can cost anywhere between $4 and $5 a piece. So they can be monitored fairly quickly and fairly easily. And those two tests have been shown over the long course, if you keep them very, very low, so if you keep the CRP under 1 and the ESR under 10, that you can go for longer in terms of progression-free and disease-free states, specifically with breast cancer. And that's really important. Using those simple, basic things on top of the other monitoring strategies such as imaging and scans and using the medications can really help a patient feel more confident in their body and making sure that we're altering that metabolic disease state. And so that allows for those cancer cells to not be as hospitable inside the body.
So it's really kind of this notion of trying to, as you say, make the body inhospitable. Sometimes the word that gets used is that we're trying to make sure that the terrain is at its optimal in order to fight sort of these things that are not ideal, whether that be other diseases, viruses, bacteria, etc. But in this case, it's actually trying to make an environment where these cancer cells don't grow. And if I heard you correctly, when we're looking at things like CRP and ESR, those are markers of inflammation. So if we have high inflammation, that actually makes it more hospitable for the cancer cells. And so instead, we want to drop that inflammation so that they can't thrive.
Exactly. So the metabolic disease process, you're exactly right, Quinn. Terrain is the word that we use naturopathically. Sometimes people don't understand what that means. And basically, it's what's happening on the inside of the body. And so that inhospitable environment allows for your immune system to recognize cancer cells sooner, so then they can kill those cancer cells. This is part of the cancering process and understanding how cancer grows. Yes, there are genetic markers. such as BRCA genes and estrogen dominance and factors such as that. But it's more important than those because lots of people still carry those markers and don't develop breast cancer. And so what's the difference between a person that does and a person that doesn't is the terrain and the environment on the inside. And there are so many factors that affect those inflammation markers, things like stress, nutrient deficiencies, secondary illnesses or diseases such as arthritis, which is commonplace for a lot of people. And so looking at that individual part of how to recover and how to really influence these inflammation markers is one big part of reducing our risk of reoccurrence.
Yeah. And are there any other tests that you tend to use really commonly outside of the CRP and ESR within breast cancer?
So there are a few others. You'll read in the book about something called the FAR ratio. So it's the fibrinogen albumin ratio. So that's another one. They do know what the percentage is for breast cancer. So if you get both of those markers, the fibrinogen, which is a clotting factor, albumin is the protein base, and they have also impacts or indications of nutrient deficiencies in the body. And so if you use them and put them together in a ratio, under 7.1% shows reduction in breast cancer reoccurrence. And so specifically in this breast cancer realm, that's another marker. The third marker that I really look for that's pretty common is also vitamin D deficiency levels. And the 80% of those, you'll probably have heard this statistic, I tell people a lot, 80% of people who've been through chemotherapy come out frankly deficient in vitamin D. We already live in a world where it's tough to get vitamin D, and a lot of patients will come in and they'll say, oh, I'm already taking it. I'm taking 1,000 units. And I say, well, we want to know that that's enough. So monitoring it and making sure that you're getting into the range where it shows to be sufficient for for cancer recovery processes. And the statistics show that you want to be in the top quarter of the range. And so in blood work for Canada numbers, you want to be between 200 and 250. And so can you imagine if you come out at 35 and you're not between 200 and 250, that's a really important factor to be a part of this process. And so I definitely talk to patients about those other two tests in terms of alternative monitoring. And you'll hear me talk about them in a lot of different videos because they are so foundational, and that's why they're so important.
Yeah. And I think specifically with the vitamin D, there's a few facets that we're looking at there in terms of the influence that vitamin D has. Can you speak to a couple of those in terms of why that vitamin D has so many touch points in terms of reducing that breast cancer recurrence risk? Yeah,
so vitamin D specifically especially in all different types of cancers, but it's in breast cancer specifically, is a building block. It's a building block that's used for bone health, most people know. And post-breast cancer, we have an increased risk of developing bone metastasis or bone deficiency issues because we're impacting those estrogen levels, and that can increase those risks. So bone health is number one. The second piece for a touch point for vitamin D is the fact that it is really tied into your immune system and how your immune system functions. And so coming out of chemotherapy or radiation, a lot of women or a lot of survivors will actually find themselves getting colds often and not realizing how that impacts their function and daily life. It's hard to become a thriver if you're constantly having strep throat or sinus infection or ear infections or a cold or bronchitis. And so vitamin D can be a key component to that kind of recovery. Vitamin D has also been linked with mental health. And so there are a lot of patients who suffer from depression and anxiety that they've never experienced before. And there are a lot of psychological factors that are related to that, but vitamin D is one of those building blocks. And so when I'm dealing with a patient, whether they're a cancer survivor or not, and they're dealing with depression or anxiety or mental health challenges, the first marker that I look for is making sure the D is in the right place. The brain cannot function without vitamin D at its right level. D also fills our cortisol coffers. And so when we talk about stress and relationship to recovery, that's important because D is a part of building cortisol. And that is really important because how can your body ask for more cortisol if it doesn't have D as a building block for it? And sometimes you need that cortisol for recovery. Sometimes you need a balancing act between the cortisols. Sometimes people are so deficient, right, that they're not able to make cortisol. Can you imagine if you're deficient in vitamin D and your body is not able to produce as much cortisol as it needs? The amount of fatigue that you're trying to overcome will be humongous. And so those are just a few strategies and impacts. I mean, there are so many more. Vitamin D is so ubiquitous in so many different processes in the body, but those are the big ones specifically with breast cancer that are very important to discover.
Yeah. And just to clarify for those that are watching, when we talk about cortisol is our main stress hormone that we're talking about. So of course, when we're going through a recovery process and we've come out of a very stressful process such as cancer treatment, that system has been very taxed already, to your point. And so therefore, if we're then deficient in a nutrient that supports it, it makes it harder for that system to recover and even do the job that it's trying to do in the first place.
Absolutely. So yeah, there's a huge chapter about stress and its impacts in terms of recovery and how it's basically a roadblock if we don't know where we're at and how we address it. And as many of us know, the world that we live in is a stressful world. And so on top of that, coming out of a cancer recovery process, there can be a lot of expectations and challenges that make more stress happen. And that can be very important. And so finding out where you're at in your stress markers and whether your body's able to produce cortisol on top of maybe not having this roadblock of not having enough vitamin D to support that process is very important.
Excellent. And I think that segues very nicely into sort of that second question where we're talking about maintenance therapies, right? So, for example, we want to maintain adequate vitamin D levels, but there's also our conventional maintenance therapies that we need to think about and how those interact with other therapies that we may be looking at. So can you talk us through a little bit of the different maintenance therapies that we want to be considering?
Yeah, so with breast cancer, there's very common ones. People know, especially if you're estrogen positive breast cancer, that they'll use something called aromatase inhibitors. So that would be anastrozole, letrozole, and all of the azoles that are in that category. So there are different ways. They use them in premenopausal women, so women that went into breast cancer with premenopause, and those that are also postmenopausal now. And they can be used from anywhere from 5 years to 10 years. And so those therapies can be very good at reducing the risk of recurrence or metastasis on sites, and I understand their usage. But unfortunately, there is a growing number of women that suffer from side effects from them that could limit their use or their effectiveness. And that really, for me, is one of the things that I like to focus on for maintenance therapies, is supporting those processes in those bodies so that we can get the best use out of these medications. There was a lot of arguments in the past, and they're coming to light now, that they're maybe not as interactive or negatively interactive. There was a lot of, I get the world of science and wanting to prove that it isn't a problem, and that's becoming more and more available. And so using herbs at the same time or using acupunctures at the same time, and I'll talk about some specifics in a minute about those, but ultimately making sure that we know that they're not going to compromise the effectiveness of those aromatase inhibitors and those maintenance therapies is really a big component. And like I said, because we've had more science, we know more now, which is awesome. And I think that there's a lot of opinions out there, and those opinions haven't been changed in the facts. And I one of the big things that I work with people is to not make decisions out of fear, right? And so there's a lot of support help groups, and a lot of my patients will come in and they'll say, oh, you can't use that therapy because it's going to increase your estrogen. And I'm like, let's look at the facts. Here are the facts, right? You can't be afraid of estrogen in the body. What we need to know is what it impacts and whether it actually impacts you to make more estrogen. Just taking a perfect example of this is phytoestrogens, and soy comes to mind because, in the early 90s, it was like soy was protective. And then in the early 2000s, it was like, nope, don't take soy because you're going to increase the risk of reoccurrence. And now we know for without a shadow of a doubt that that's not the case. There are some women that overeat soy, for example, and there are some cultures that have overexposure to it, and absolutely anything in abundance could absolutely impact this metabolic process, towards disease. However, in moderation, in the right types of patients, in the right types of people, which are all proven in science, it has actually been shown to be protective, especially when taken in the entire food. And that's one of the things that we have to know about the things that we use in the natural realm, is that they're not, unlike medications, they don't interfere, so they have a synergistic effect. And so because of that, they don't directly interfere in one capacity or another. And so the science that we're showing is actually showing that the entirety of this herb or the entirety of this food is actually more beneficial than we know and imagine it to be, which is awesome because that's what, the nature does for us, right? It gives us that synergistic effect. And so one of the big things that patients will come to me is with hair loss. Many patients who've gone through conventional treatment will have lost their hair based on the type of chemotherapy or the stress that they were under. And so when they get to the growing stage of hair, and then they also add in, this aromatase inhibitor, which makes them stop growing that hair or it starts falling out again, there's a lot of panic and upset. And I get that because they're done wearing wigs and they want to, feel like themselves and develop some body confidence back. And hair being regrowth, especially if we lose all of it, can be hugely problematic for our mental capacity and how we feel about our bodies. And so hair loss for me is really important to go down to the foundations and the basics. The first thing is that a lot of women forget to eat enough protein. And so the question is, what is that actually? And protein can be a part of being able to develop our hair growth and work through that process. And so that's a basic that I really try and hone in on for patients. The second thing is stress reduction. Our hair does not grow and we lose a lot of hair when we're under stress. And so we were just talking a little bit about stress and its impact and cortisol and the cancering process's impact on stress. And so I really highly encourage patients to go into my book and read the section on stress, which is in the release chapter. Learning more about how it impacts you and where you're at can be a big part of the process in terms of making sure we don't have more hair loss. Nutrient deficiencies, we just talked about vitamin D. There are some other nutrients such as iron and B12 that can be a part of hair growth. And that's really important to understand where your numbers are at. A lot of women will be, they'll be in this process where they'll have anemia post-treatment and they might have trouble recovering the anemia, right? So they might have red and white blood cells that are low and they're having trouble recovering it. And so they'll be told to just take iron. Well, iron can be a challenge to increase, especially if you have GI concerns that are left over, just in general, but then also left over from treatment. And so sometimes patients don't take enough iron or they don't have the right kinds or they don't even know to take iron because no one's monitoring that specific nutrient for them. And that can be a part of hair growth for sure. There are some topical treatments that we talk about, and there are some controversy over those. Some women will use topical essential oil of rosemary. Others will say that it increases estrogen rates, and anything that helps your hair growth is going to increase estrogen. And I think that that's a simplified way of looking at it. There are some really great studies that show that using small amounts of rosemary essential oil in a carrier such as coconut oil has not been shown to increase estrogen rates and has been shown to be beneficial in terms of hair growth. And so that's really cool and very helpful because it's an external treatment. There are other things, there are other conventional, shampoos and conditioners that people will use to help with hair growth. I always caution people about what other additives they have in them, and we're going to do an entire series of videos on environmental toxins so that you can do a better job of making sure that they don't carry things that also can cause cancer. But that's specific to hair loss. The second side effect that we can have from these aromatase inhibitors is joint pain. And that is really interesting because it ties into those inflammatory markers. A lot of people in my practice that I've seen that we talked about the CRP and the ESR, if they have elevated levels of those and they're taking an aromatase inhibitor, that increases their risk of having this debilitating joint pain. And so one of the ways that we do is we monitor their CRP and ESR. We get those numbers down by using things such as omega-3s and curcumin and different other natural anti-inflammatories to really help monitor and reduce that joint pain that can be so debilitating. I just talked about omega-3s. So the other way to keep joint health happy and to get that positive benefit in terms of lubrication for the joints is making sure omega-3s and good fats are a part of the dietary process. And so a lot of times that's supplementing with a fish oil, for example, or a vegetarian source, algae, some people get worried about flax because of the possibility of phytoestrogenics. But again, it's a bigger component to that than just that. And pressed oil generally doesn't have those phytoestrogenics. So that is an option for those that don't like fish or have a fish allergy or are interested in a vegetarian source. And then hydration. Hydration is key for joint health. There are some physical therapies. If all of those things don't work for the joint pain, acupuncture has been shown to be very proven to help with that debilitating joint pain. And then, of course, stretching exercises like yoga and Pilates, seeing physiotherapy, those can all be beneficial to help reduce some of those joint pains and aches. And the last one that can be super debilitating that a lot of people suffer from is hot flashes. These hot flashes can be hugely detrimental. They can be waking people up in the middle of the night, impacting sleep, impacting the health and mental health and well-being of every day and function. They can stop you in your tracks and make you feel like your skin is on fire. They can have a huge impact on mood shifts and mood changes as well. And that really is important from a hot flash perspective in terms of managing them. So there are lots of studies that show acupuncture is very beneficial. More hours on the table is better. There are two components where these hot flashes come from. There's the component of being thrown into a menopausal state for those that are perimenopausal before they go through the breast cancer process, or for those that are postmenopausal and then being thrown into, that menopausal state again. That can be challenging. There is a second part of this. So it's not just hormonal that causes these hot flashes. The second part is, surprise, surprise, cortisol and stress. And those can bring on those hot flashes as well. And we tend to be in that stressed state, stress survivor state after treatment. And so it's an increased risk of developing, those hot flashes, those debilitating hot flashes. So there are some newer studies that are coming out that show that are beneficial herbs that can be used. They're herbs that we use commonly in the menopausal process. Things like black cohosh, Romania, and Schisandra. There's always the argument that anything that we would use herbally could increase the risk of estrogens. These 3 herbs have been studied around the world to show that they don't interfere with the process of the drugs, and that they do actually address hot flashes without increasing estrogen levels. Some of those studies are newer and they need to be more advanced. For example, the black cohosh ones, but other ones have been around for 5 to 8 years, the Romania and Schisandra, and they're commonly used overseas in a lot of places like Japan and Asia and China, so to manage hot flashes. I always also talk with patients about limiting these side effects can increase the benefit of taking the medication. So worst case scenario is it reduces the risk of these reduces the function of these medications by 5%. But if you're able to take it for the allotted amount of time and it's still 95% effective, then maybe we have a conversation to be had about this. And so it is a lot to talk about. There are some newer herbs that have been shown that they don't interfere with the breakdown of these aromatase inhibitors, because a lot of times, we'll have an argument or a heated discussion about them, and it's not just about impacting the estrogen levels, but it's also about whether they impact the liver and whether enough drug is available in these places. And so we have the studies to show that these herbs, such as curcumin, such as St. John's wort, such as black cohosh, such as Romania and Schisandra, actually don't interfere with liver function and the actual availability of these herbs in the body, or these medications in the body.
Okay. So I think that then brings us to sort of the last question, which is this notion of, we've gone through a life-altering process. In some cases, our physical body, especially with breast cancer, has been legitimately altered. Some women obviously going through full mastectomies or partial mastectomies. And so learning to be in our bodies again from that perspective, but also, again, some of these medications changing the way that we function in our bodies. And so how do we actually kind of start to reintegrate into our cells? How do we start to redevelop that body confidence so that we can kind of move forward with our lives and find a new place of comfort?
Yeah, so body confidence is huge. It's a big step to getting from surviving to thriving, which is one of the whole purposes of these videos, and the book is to help survivors move beyond survival and into thriving. Body confidence is that last step of that metabolic disease process. And so physically, we've gone in when we've taken a look at the metabolic disease on the inside and making that terrain good. So you will feel better just by the inflammation bringing down. You will feel better when we know we're addressing nutrient deficiencies. But beyond the physical part, there's a mental, emotional component, because the body that you grew up in is a body that doesn't exist in the same way. It's been altered both from an internal perspective and even in breast cancer, a physiological perspective, going from knowing that you have breasts to knowing that you don't and having scars left, or even going from getting a surgery that replaces those with alternatives, but those are totally new and foreign objects to you and they don't feel the same.
So meaning like a
reconstruction surgery, right? So which is an option for a lot of women. And so the piece that we don't talk about a lot is all of these alterations have scar tissue as a part of their recovery process. And that scar tissue can create limitations. It can create pain spots. It can create different different flexibility ranges. It can have a huge impact on muscular development, and it can feel very disfiguring, right? To go from a body that doesn't have any scars on it to having huge scars based on doing hysterectomies or doing radical mastectomies, bilateral radical mastectomies. These are all things that we have to consider. So when we go through the physical process of the internal body, yes, we're making it so it's easier to feel better on the inside, but the piece is that we also have to get used to seeing ourselves in the mirror, used to seeing the changes. Some of those changes can include physical touch and loss of intimacy. Some of those changes can include, weight loss or weight gain, or muscle loss or muscle gain, because of how long you're in that process and those changes physically to the body. So the surgery is one part. There's the disfiguration, there's the reconnection, there's the scar tissue that we have to overcome. A lot of that can take psychological support. A lot of that can take, mind frame work, right? And some of the things that we talk about in the book is about renewing life and learning to love who you are now and getting to know yourself. And so that can be a self-exploration. That can be simple exercises like looking in the mirror. It can be dressing differently, wearing different colors, changing things about the way that you normally would dress and just redefining who you are. And so that's a big piece. The second piece to the surgical scars and stuff is actually working through those scars so that they become more a part of your body and so that it's not this stop function. And so that's about doing physical therapies, moving into those flexibility things. There are topical treatments such as castor oil that we can use with heat. There is sauning that we can use to help with detoxification of those areas and really getting the blood flow to those areas. And so surgically, working with that is very important. And those are some of the things that I recommend. The loss of intimacy and that body confidence piece can be from everything from physical touch to sexual libido. And that's really important because a lot of women find themselves going through this at earlier stages, right? There are younger and younger women being put through this process, or women who are in their 60s supposed to enjoy their retirement fully. And now all of a sudden they've had this huge bump in the road that they have to overcome. And so that loss of intimacy can feel really isolating. And so sometimes it'll be as simple as someone was a big hugger, for example, and then all of a sudden they don't want anyone to touch them. And part of that's because they don't know what their body is, but part of that is also because we have to remember going through this process, you have to be very vulnerable. Strangers are touching you and poking you and doing all kinds of things to you. You're getting put into tubes for imaging and you're wearing contrast and they're shoving stuff in your veins that you never thought before. And so we have to recognize that level of vulnerability can close some people off who were very touch-based. Some people also who are very touch-based continue to like that touch-based, but then all of a sudden they can't achieve the same intimacy levels. And so now we're talking about sexual function. Some people will struggle with the fact that they're not able to achieve orgasm anymore because things have changed, right? Post radical hysterectomy, there are some things that happen, in the vaginal area and in the canal, and things cannot feel as good. Same with some of those maintenance therapies we were talking about, right? Some of those aromatase inhibitors can create a lot of dryness, vaginal dryness. It can recreate a lot more vaginal dryness, and these things can be really challenging to be able to manage. And so there's so many levels of loss of intimacy, as you can see, and it can affect everyone in a different way. And so one of the things that I talk to patients about is actually having conversations, either in a confidential manner with, a therapist that understands these things, a physical therapist that can provide you with the guidance, right, and the connection, or, even doing it on your own in terms of sitting down and writing some things out, having a journal, maybe making some videos for yourself that you can only watch and then delete, some way to reconnect with that intimacy. It is an important part to talk about because that is a part of that body confidence, that is that next level. A lot of women or a lot of people what they look like is how they identify their femininity or their place in the world or their femaleness or their personness, right, their humanness. And now when that changes and alters, that can be a very big step. And so there's everything from psychological counseling that people need to go through to partnership, to discussing boundaries, to getting physical support. So in some of those ways that we physically change, in the vaginal area, there are studies that show even if you're hormone-dependent breast cancer, you can use topical estriol, for example, in very low doses to help to reduce that vaginal dryness and help deal with, some of those sexual interferences that you're experiencing, including achieving orgasm. And so there are lots of ways to have and rebuild the body confidence that we each need to figure out how they affect us. Some people, it's not a big deal that they've lost intimacy, but then other people have to deal with the fact that their partners have to grieve the loss of intimacy. And so there is a connection, and that I think is a big piece for me, is highlighting this because isolation is so troubling when we're going through this recovery process. To go from surviving to thriving, we really need to get out of that isolation and recognize that on different levels, it's not just about having people around us, but about understanding what that piece to our body and that physical body is in terms of recovering.
Yeah, absolutely. And just to go back a step too, in terms of just to clarify for listeners that when you're talking about something like topical estriol, estriol is one, we have 3 forms of estrogen in the body.
Yep,
and so
absolutely.
this is one of the sort of least problematic or influential forms that people can use in order to help regain certain functions. As you were saying, vaginal dryness is a common thing that can obviously make intercourse with one's partner uncomfortable, but also just even day to day, women walking around can actually feel friction and discomfort when there's vaginal dryness.
The big key piece to this is also working with someone who understands, someone who has a history and understands the risks that are associated with, someone that has read the studies and knows what they're doing in terms of topical treatments, and someone that has the ability to find all the other steps. Because although that is a possibility, a lot of times when I'm working with patients, I like to do the first ones first. So using a non-hormonal based intervention to see if we get the effectiveness that we need. And if we don't, say we only get 70% better and it's not all the way better, then we can bring that in, but at a very low dose, at a very small amount, so that patients feel very confident in the risk that they're taking that is associated with it. Because although there are studies, obviously we can't predict the future for everyone. And so there is studies to show that it's safe, but it is, again, about partnering with a person who understands the risks and can have those conversations with you. And that's really, really important.